Well, since our meeting in June, we've had the opportunity to have several follow-up calls with the commissioners to talk about the paper and the report that's evolving from our deliberations, but we also had the opportunity to have a site visit, a field visit to Kenya in August to really see at the ground level what are some of the obstacles, what are some of the challenges, but also what are some of the practical solutions that are already being put in place.
I had an opportunity to engage with U.S. government employees through our embassies, USAID, and to see how this comes together on the ground, to see what kind of a difference it's making with people.
Today was a great opportunity to look at the work that's been done so far, our reflections from our trip to Kenya, and think about how do we put together this report that we're working on to look 15 years in the future. How do we really build activities towards a greater sustainability of improved health globally, but also how can we look at some of the short-term and immediate things that we can do that can have an impact on the health of people around the globe.
There were a couple of points. One, to put in play a draft of our final report, to explore a little bit further how do we take what up until now has essentially been the focal point of a small group of people working literally to save millions who are at risk around the world, and to carry that forward in a manner that might energize a much broader audience. One of the other things that we're doing is outreach into various groups in different parts of the country, appealing to regional centers of excellence to show how the work of this commission is very complementary to many other kinds of efforts going on in different parts of the country.
We also want to use the report as a way of engaging the American public more broadly in the issue of global health. We feel it's important that the American public realize that this is a good investment, and it's an important investment not only in the future of people around the world, but that it is also in our best interest to make sure that other nations have access to health and health services.